Hello and welcome to the Education, Health and Care Needs Assessment Paperwork webcast. The aims of this webcast are to give a brief overview of the paperwork needed for an Education, Health and Care Needs Assessment and how to be aware to log in to Liquid Logic to create an EHCNA. So, what sort of paperwork do we need in order to do an EHCNA? We recommend 2 IPMs and reviews signed by parents and setting. You may have support plans that have addressed more generic issues such as physical, behavioural or speech and language needs. Obviously, they will have their accompanying reviews. A list showing dates when IPMs were started, review dates and a new IPM date set. A useful document is an outline of the strategies that you have trialled over time and the outcomes. Also, a record highlighting the types of interventions, support and staffing that have been used in order to support the child's needs. Also, evidence of funding that you have received to help support you with the child's needs. For example, GR4, challenge or exceptional funding is the most common when a child is going forward for an EHCP. Other documents that are useful are a selection of your records of intervention, possibly 2 or 3 sheets per individual provision map, plus 2 or 3 summative observation sheets relating to the targets. Also, early support tracking documents relating to their secure levels. A child's view sheet. Now, we know that this is the tough part of an EHCNA with children with additional needs in the early years who are possibly non-verbal. We would be suggesting that you provide 4 photographs annotated showing where support is needed. So, for example, a photograph of a little one sitting at story time with Sarah, the key person, and with a comment around it such as, "I enjoy story time with help from Sarah." A really useful log is that of the outside agencies and support that you have received from all those visiting professionals or liaisons with them, any meetings that you may have attended or any visits that they have actually done in setting. It's also very useful to have this information from parents so that you can add to the list. Any external agency reports such as speech and language, PD outreach, and any summary sheets that you may have received from the Inclusion Support Service. You will be asked about attendance, so hopefully you have got to your fingertips the last 3 terms of attendance, and that will include the number of possible times they could have attended and their actual times. This is a really important bit of information for the assessment panel to see, as it likes to be noted that the child has attended and therefore has had time to make some progress, and if this isn't the case then they can see that it isn't down to the fact that they haven't attended. We do advise that you number these documents to form an appendix and scan them into one PDF file if possible to upload onto Liquid Logic. You need these before completing the online RS36. The RS36 should now be available to complete on Liquid Logic. All of the rest of the information, for example the family conversation, with the medical questionnaire included, the child's views, and all of the supporting evidence that we've alluded to in this presentation needs to be scanned and uploaded to Liquid Logic. The Liquid Logic user guide can be found visiting the link shown here.
If you have found this information interesting and would like to know more, the Early Years Inclusion team have additional team training. You can search and book CPD online by visiting our website listed here. We also have Effective Individual Provision Map IPM writing training, Promoting Positive Behaviour Management training, training for new SENCOs, and we have our SENCO forum clusters. Thank you. Bye.